Michael Goodluck, biology and medicine videos. Join the group, post interesting things like comments, ask questions and answer questions, improve the graphic settings and the quality of the diagrams. Then lastly, subscribe to get more information about medicine. In this video, we are going to look at the subtopic of the topic pharmacology, which is known as the route of administration. Route of administration. Route of administration of drugs. Route of administration of drugs. Under this, we are going to look at intravenous route, we are going to look at intramuscular routes, we are going to look at subcutaneous route, we're going to look at vaginal routes, we're going to look at rectal route, we will also look at the aortic route, we will look at nasal route, we will look at cutaneous route, we will look at transdermal route, we will look at sublingual route, we will look at intrathecal route, we will look at ocular route, we will look at oral route, among other routes of administration. When you talk about the routes of administration, you are talking about the specific part in the body where the drugs is introduced, or where the drugs is administered, or where the drugs is passed to reach the site of action. That is briefly what we can talk about route. Route of administration of drugs is the specific part of the body where the drugs is introduced. Where the drug is introduced or passed or administered to reach the site of action. That's briefly how we can define our routes of administration of drugs. Under here, we want to look at this groupically, and we are going to begin with the site of the skin, or passing the drugs through the skin. Some drugs is given through the skin. Some drugs is given through the skin, and this can be done by injecting the needle. Needle into the tissues, and the drugs is released. Yes, some drugs is given through the skin, and it can be done by injecting the needle in the tissues, and the drugs is released. Let's assume this is our skin. This is our skin, and then the needle is inserted into the tissue. This is the skin into the tissue, and then the drug therefore is released in the tissue, and this can be done through subcutaneous. Can be done through intramuscular, can be done through intravenous, and can be done by patch. That is implant or implantation. So looking away straight into subcutaneous or subcutaneous, for subcutaneous, a needle is inserted into fatty tissues. For subcutaneous, a needle is inserted into fatty tissues. For subcutaneous, a needle is inserted into fatty tissues just beneath the skin. They inject beneath the skin, and the needle must reach into the fatty tissues, and after a drug is inserted, a drug is pushed, is inserted. It's then moved into small blood vessels. These inserted drugs then move into small blood vessels known as capillaries. Others pass through lymphatic system. Others pass through lymphatic system. Then into the blood capillaries, and then into the site of actions. Alternatively, a drug reach into bloodstream through lymphatic system, which we have already said it, This is because these types of drugs move slowly. All types or groups of drugs moves slowly. They move slowly, and it's used for some drugs that needs a long-term therapeutic effect. Yes, for some drugs that take long time therapeutic effect. Example is insulin. Example, insulin. Which is used for treating diabetes. Certain drugs such as progestins, certain drugs such as progesterone, which is used for hormonal birth control, are also passed through subcutaneous. Example is progesterone, which is placed in form of plastic under the skin. Placed under the skin, and take 3 years. Take like its therapeutic effect and its therapeutic effect takes 3 years. So another example is etonogestrel, progesterone, etonogestrel, and among others. I hope this will make sense. In the next video, we shall be looking at intramuscular routes of skin administration. Bye bye.